Hi, this is Dr. Jason Hahn. Welcome to the last video, the 6th video in our series where we're talking about knee pain, especially when your foot is turned out. If you missed our last video where we assessed hip internal rotation, click the link above and make sure you like and subscribe to our channel so you don't miss anything moving forward. So let's move forward to our next assessment. Right now we're going to assess the strength and the performance of the lateral glute muscle, more specifically the posterior fibers of the gluteus medius, not like you care. But in our situation, if you went back to the first assessment, we looked at a single leg balance and a single leg squat. It's dysfunctional when you start to see your knee fall in, and you're probably wondering why that's happening. In a lot of cases, these muscles here on the side are not doing their job to pull it back into place. So yes, we can do all the hands-on and soft tissue work that we want in the world, but if we don't get the underlying causes stronger, then we're never gonna make the gains that we want. So here's the assessment for the hip. So now we're gonna assess the performance of the lateral glute muscles. It's pretty easy, kind of. You're gonna lie on your side, lower leg is bent, you're gonna stack your hips on top of each other, and then brace your core. So that is the starting position. You've seen these Jane Fonda workouts. Essentially, you're just gonna raise your leg 30 times. You can do it on both sides. So let's say I do 30 times on this side, and I have a certain level of fatigue. That is a level of strength. Then I'm gonna do the opposite side and look at that level of strength. So that's one thing you're going to assess. The other thing is, where do you feel the exercise? If, in a lot of cases, I have my clients raise their leg right here and they feel it here. If you feel it here, you're doing it wrong. You should be using this muscle in the back. In a lot of other cases, you're feeling it here, you're feeling it here, or you're feeling it here in your low back. If you're feeling it in any of those locations and not here, you're probably doing the exercise wrong. So it's important to do this assessment to, number one, look at strength, and number two, neurologically, how does your body move in that case? All right, let's sum up all of the 6 assessments. If you go back to the first video, we looked at the single leg squat, single leg balance performance. Functionally, if you're standing on one leg and your knee is falling inwards, movement dysfunction wise, that may be a big cause of why you're having knee pain in the first place. So we went on to the second video where we talked about the ankle and the big toe. Again, if you don't have enough range of motion in those joints, every time you take a step, it's gonna move through somewhere else. And more particularly, in this case, your knee. On the third video, we looked at the actual rotation of the knee joint, the tibia on the femur itself. If you don't have enough range of motion there, that may be why you are dealing with this knee pain. In the fourth video, we looked at the dominance of the lateral hamstring. You lied on your stomach, you bent your knee. If your foot turned out, that meant you may have a dominance of one side of your hamstring, which may be contributing to the knee pain itself. In the fifth video, we looked at hip internal rotation. Again, even if you wanted to walk straight, but your hips don't move in far enough, that may be a cause of why you can't do that. And last but not least, we looked at the performance and the strength of the lateral glute muscles. Very, very important, because every time you take a step, every time you run and jump, if that muscle's not working, the knee is caving in. So if you've done any of these assessments and you've found some dysfunctions that you may have, hopefully you have a way to fix it. Feel free to check out our website at healthfitinc.com or give us a call at 626-365-1380. We are always looking for feedback and we are always looking for suggestions on videos moving forward. So feel free to leave a comment in the area below, and we really look forward to helping you.